I've got my eyes on backwards, hoping that a new day's dawning. I've got my shades down low, hoping it's enough to cover the sun.
Alright, so this is Dr. Thornley, and this is part 13 of my medical marijuana series. And today I'll be going over the endocannabinoid pathway and the cannabinoids and its role in glaucoma. I'm a neurologist, Dr. Thornley, and I subspecialize in epilepsy. And this video series is to serve for informational and educational purposes only. So just as a review, so the endocannabinoid pathway is responsible for the runner's high. It's not endorphins, because endorphins have too large a molecule to pass through the blood-brain barrier. It's not serotonin, it's not norepinephrine, it's the endocannabinoid pathway, which is responsible for the sense of well-being. Within this pathway, there are two types of receptors, CB1, CB2. Those are the most commonly studied, and they're G-related proteins. And then there are two well-studied and most popular of the phytocannabinoids, which have medical value. There's some other phytocannabinoids, but they're not as well studied or well documented. So there's CBD, which is non-psychoactive, and then THC, tetrahydrocannabinol. At low doses is also non-psychoactive, and together they work synergistically, having an entourage effect, meaning they enhance each other's properties. The CBD also offsets side effects of THC, which can include paranoia, hyperactivity, and agitation. So in glaucoma, within your eyeball, there's buildup of intraocular pressure. And when that happens, usually it's because of a narrow angle pathology where the aqueous humor cannot drain. So there's buildup of pressure. And then with the increase of pressure, this damages the retinal cells. So within your eyeball, the images are seen by the retina, picked up, transmitted into electrical impulses, and carried over through the optic nerve or cranial nerve 2, goes through your optic chiasm to be picked up in the occipital lobes, giving rise to your vision, which your brain processes. So with glaucoma, the damage is at the level of the retina because of all that increased pressure. And ophthalmologists have that dilemma of trying to treat this, and usually medications are not always ideal or not effective. And so this is where the cannabinoids come in. So there have been some studies in ElSohly's previous article, and this was he at that time in when he did this study in the 1980s, 1984, he discovered or described 32 phytocannabinoids. Now it's 100. So everything that I say may be negated a couple years from now because of the fast changing pace of research. So he found that it's the delta 9 THC and the 8 THC that works on glaucoma. In addition, there was also a veterinary study where they applied 2% THC and in 21 dogs, which were normal, and it reduced the intraocular pressure. There's also been studies that found that it's actually at the level of NMDA where cannabinoids exert their effects. So NMDA is a neurotransmitter that's excitatory, and so anything excitatory can cause damage. So it's thought to antagonize at the level of the NMDA system. So NMDA, well known to neurologists as an excitatory neurotransmitter. So that's where it can cause damage to the process of glaucoma. It was also found to reduce free radicals, which may be floating around, and also reduce apoptosis. Apoptosis is cell death. So it's through all these mechanisms of where the cannabinoid path system works. And in my review of the scientific literature, there's a lot more scientific data compared to clinical studies for cannabinoids to work to reduce glaucoma or to treat the glaucoma. Okay, so I hope this has been helpful, and so just reviewing my first part, 1 to 5 of my series goes over mechanisms, indications, treatments, ways of administering. 6 to 13 goes over the disease process, reviews clinical and scientific articles. So glaucoma, even though there's not a lot of clinical trials or studies, it's found that at the cellular level that the cannabinoids can help. And there's always a starting point for everything. So I hope that was helpful. And it's the THC component that helps with reduction of intraocular pressure, not so much the CBD. So the THC was found to be the substance that helps. Okay, and this ends my session on glaucoma. This is Dr. Thrani signing off.